Vince, welcome to Health Connection. Thank you for joining us. You're a pharmacist here at UT Health Northeast, and we're glad to have you be a part of Health Connection.
Thank you.
We're going to talk about omega-3 fatty acids, fish oil supplements. We're going to that whole subject is in the news and has been lately. Let's start with a definition first off. What is an omega-3 fatty acid?
Omega-3s are essential to our bodies. They're deemed essential fatty acids. We have to get those from our diet, and those primarily come from seafood, fatty fishes, and shellfish, and primarily used to reduce inflammation in our bodies.
So that may have answered the second question. What are the benefits of omega-3 fatty acids? What do they do?
Well, it's the start of answering the second question. Omega-3s are wonderful at reducing inflammation in the body, all throughout the body. They, as fish oil delivers the omega-3s, they've got so many good health benefits. One of them would be the cardiovascular benefits. By taking and getting ample omega-3s in our diet, we often see reduction of bad cholesterol, reduction of the triglycerides, and an increase of the good cholesterol. So the cardiovascular benefits have been well documented over time. We see reduction in pain and inflammation of the joints. It's very helpful in rheumatoid arthritis and macular degeneration. It has some application even with brain function. It can help stave off dementia and Alzheimer's later on in life. So those are just some of the many things that have been studied, and they're just, the longer we look at it, the more health benefits we tend to find.
Well, yet for all that benefit, it was a huge surprise this summer when the news came out linking fish oil supplements with increased risk for aggressive prostate cancer in men. What happened?
Well, there's a lot of history to that, and I believe it starts, you have to go back and look at a study that took place between 2001 and 2008. That study was called the SELECT study, and researchers were looking at the effects of selenium and vitamin E in prevention of prostate cancer. Well, that study concluded in 2008, but other researchers looked at some of the data that they collected, and they determined that men with the highest levels of omega-3s in their blood had a 44% increased risk of developing prostate cancer. And this was a surprise. It contradicted other studies that had been done with fish oil or omega-3s and prostate cancer.
So what is this telling us? What does it mean?
What it means is that we don't really know what it means, because the study that was done the second time just looked at a single blood draw, and they just made a correlation of omega-3s in the blood and prostate cancer. They don't know how they got the omega-3s. There was nothing done determining diet, nothing done determining supplementation. And you could easily jump to the conclusion that says, oh, omega-3s are bad. But if you look at the history of large populations like Japan that primarily have fish as a staple in their diet, they historically have had a very low incidence relative to the U.S. of prostate cancer in men. So we know that it's complex, and we know that there are a lot of pieces to the puzzle that we don't know.
Well, let's get and I think you covered this earlier, but if we need to amplify a little bit, let's do so. What foods contain high levels of omega-3 fatty acids?
What you're really after to get your omega-3s are fatty fish, and the preferred fatty fish would be something like salmon or tuna. Lake trout is good. Sardines are good. You can get omega-3s from shellfish also. Lobster and crab are also have that benefit of the omega-3s. Now that covers two of the essential fatty acids. You can get omega-3s from plants also. Walnuts have ALA in it, which is a building block for omega-3s. Along with that, there's canola oil, soybean oil, flaxseed, olive oil is excellent also.
To get the benefit from all of this, how often do I need to consume these foods?
Well, much of it you can get in your diet, you can switch over to some of those oils, as your cooking oils. But twice a week on the fish has been, a recent study has shown that it can reduce cardiovascular events by up to 35%. So it is very significant.
I'm sure it's safe to say that it's better to get omega-3s from food, but is there any reason that I or a man or anyone should not take fish oil supplements?
Well, fish oil supplements for somebody that's on anticoagulants, that could be an issue because there is some thinning of the blood. So you would want to use caution if you're on a blood thinner. The other thing that we need to consider on whether or not we should supplement with fish oil are basic genetics. We're all different. And some of the things that we've talked about a little bit already, like rheumatoid arthritis, and if you've got a strong family history of rheumatoid arthritis or a strong family history of cardiovascular disease, certainly omega-3s would be something that you would want to take a look at. But also, knowing what the little bit that we know and a possible connection to prostate cancer, if you have a strong history of prostate cancer, you may want to wait until more data comes out so that we know exactly where that path is going to lead us.
Okay, well, let's say that I've gotten there. I've decided I'm going to take fish oil supplements, or my doctor recommends that I take fish oil supplements. Is there anything I should look for in the way of brand?
There are a few things that a consumer should be aware of. Certainly, you want to choose a brand that's mercury, metal-free, and they'll usually say that right on the bottle. You'll want to choose a brand where the omega-3s are higher in that brand. Just because it says 1,000 milligrams doesn't mean you're getting 1,000 milligrams of omega-3s.
So we talked about supplements, we talked about diet. What difference does it make to the body in taking fish oil supplements versus eating foods that are high in omega-3s? Is it all the same or is it not?
Well, I think we have to look at what we're getting. When you take a fish oil capsule, you're getting exactly that. You're getting fish oil that has some omega-3s in it. But when you're eating fish, you're getting really what Mother Nature intended, and that is the fish oil with the omega-3s and other nutrients and molecules that work in tandem with those things. And so, it's my belief that the natural route is a better way to go.
Very well. Vince, thank you for joining us. We appreciate it. Good to have you.
So thank you for having me.